Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover a condition called Pronator Syndrome. Pronator Syndrome is compression or entrapment of the median nerve in the forearm. Any type of nerve entrapment condition can lead to physiological issues, which lead to pathology, which can then lead to anatomical changes, which can lead to further pathology. So anytime there's a nerve entrapment or nerve compression condition, you want to get it treated immediately. Pronator syndrome is often abbreviated to PS. Pronator syndrome is entrapment of the median nerve as it passes between the ulnar and radial heads of the Pronator Teres muscle or under the proximal edge of the flexor digitorum superficialis muscle. This is a condition that is fairly rare, but it's a condition that occurs in archery, in weightlifters, in bodybuilders, in baseball pitchers, throwing athletes, and in racquet sports. Sources of pronator syndrome include hypertrophy of the Pronator Teres muscle. There can also be a ganglion cyst that is the source, also a congenital abnormality or a trauma. But in most cases with athletes, it is hypertrophy of the Pronator Teres muscle. The symptoms of pronator syndrome have an insidious onset, meaning that they start very lightly and gradually progress to be more frequent and more intense. This condition may take months or even years to get properly diagnosed. Many times it is confused with carpal tunnel syndrome because carpal tunnel syndrome is also impingement on the median nerve but at a different location. The impingement of the median nerve in carpal tunnel occurs at the wrist, while the impingement of the median nerve in pronator syndrome occurs in the forearm. I'm going to go over a little bit of anatomy just so you understand the different positions and the motions that I'm speaking about. When we speak about the anatomical position, the arms are down by the side and the palms are facing forward. Therefore, the anterior aspect of the forearm is right here. This is the posterior aspect, the medial, and the lateral. Right now, the forearm is in a neutral position. This is supination, and this is pronation. Again, pronation is when the palm is facing downwards. Supination is when the palm is facing upwards. Disclaimer alert. If you have pronator syndrome, or if you think you have pronator syndrome, please see a medical professional. You can see a medical professional like myself, a doctor of chiropractic, or you can see another type of medical professional. Please do not self-diagnose yourself. Watching this video does not take the place of seeing a medical professional. Please do yourself a big favor. See a medical professional, get an evaluation and a proper diagnosis that will help set you on your direct path to recovery. Also, never perform an exercise that elicits or intensifies symptoms. Please, if you are trying to recover from this condition, if you are rehabbing this condition, work with a professional who will be able to guide you in the right direction. As I stated earlier, the symptoms of pronator syndrome usually have an insidious onset. These symptoms include dull, achy pain in the proximal anterior forearm, paresthesia, which is numbness, tingling, and or burning along the distribution of the median nerve, which is the thumb, the index finger, the middle finger, and this side of the ring finger. So again, there can be numbness, tingling, or burning in the distribution of the median nerve, which would be the thumb, the index finger, the middle finger, and this side of the ring finger. There can also be aggravation of these symptoms when there is repetitive forearm pronation and supination. So again, the symptoms of pronator syndrome include a dull, achy pain in the proximal anterior forearm, paresthesia, which is numbness, tingling, or burning along the distribution of the median nerve, which is the thumb, the index finger, the middle finger, and this side of the ring finger. And these symptoms are usually aggravated by repetitive forearm pronation and supination. Pronator syndrome and carpal tunnel syndrome are both conditions where there is entrapment of the median nerve. These entrapments occur at different locations in these conditions. The difference in the symptoms of the entrapment of these two conditions are, in pronator syndrome, there is usually paresthesia right here. This is called the thenar eminence. This does not occur during carpal tunnel syndrome because one of the nerves branches off before it goes through the carpal tunnel. So in pronator syndrome, there can be paresthesia right here, which does not exist during carpal tunnel syndrome. Also, usually during pronator syndrome, these symptoms do not occur in the evening or at nighttime. Many times during carpal tunnel syndrome, the first symptom of carpal tunnel syndrome is paresthesia in the hand along the median nerve at nighttime. This does not occur in most cases during pronator syndrome. Also during pronator syndrome, there is pain or symptom aggravation through resisted forearm pronation, meaning that if we have the forearm in a neutral position and we try to resist it turning into pronation, that can elicit symptoms. If direct pressure is applied to the pronator teres muscle when the forearm is supinated and the elbow is extended in this position, if there is pressure placed on the pronator teres muscle, that could elicit symptoms of pronator syndrome. If it was carpal tunnel syndrome, that would not happen if direct pressure was placed on the pronator teres muscle. Also, if there is resistance to the flexor digitorum superficialis with resisted middle finger flexion, that can also elicit the symptoms, and that should not occur during carpal tunnel syndrome. So those are the main differences between pronator syndrome and carpal tunnel syndrome. Prevention is key in any type of injury, but especially in athletic injuries. To prevent this type of injury, especially when it is caused by hypertrophy of the pronator teres muscle, you want to make sure that you get adequate rest between your training sessions and that you have balance in opposing muscle strength. You don't want to create a strength imbalance between opposing muscles. So you want to make sure that you work both sides equally. Also, you want to get adequate rest between your training sessions. If symptoms should occur, please take action immediately. Do not hesitate. If there is a nerve entrapment condition, this can lead to further pathology. So please see a medical professional and get this taken care of. As a doctor of chiropractic, nerve entrapment conditions are something I see in my office every day. Pronator syndrome is an impingement of the median nerve. So if you have this condition, see a medical professional. If you see a doctor of chiropractic like myself, I would check the entire chain of the median nerve. That means I would check the cervical spine, which is the medical terminology for the neck, the thoracic spine, which is the medical terminology for the mid-back. I would check the scapular muscles, the shoulder, the motion in the whole shoulder complex. I would check the upper arm, the elbow, and the forearm, wrist, and hand. And then my treatment would consist of the same type of thing. I would work the entire chain of those nerves to try to eliminate the sources of this condition. Several things you could do for self-treatment is you can do self-massage on the pronator teres muscle or on the flexor digitorum superficialis. You can also perform stretching of the pronator teres muscle. This can be performed with the elbow in extension or with the elbow in flexion. Anytime you are stretching a muscle, please move into the stretch slowly, hold a mild, comfortable stretch, and then move out of the stretch slowly. If any stretch or strengthening exercise elicits symptoms or increases symptoms, you want to stop immediately and find a viable substitute. Please, again, if any stretch or strengthening exercise intensifies symptoms or elicits symptoms, please stop immediately and find a viable substitute. When performing strengthening exercises, always work through a pain-free range of motion. You want to start any type of exercise program, and especially if it is a injury rehab program, at your current level. Do not try to start at the level that you were before you got injured, or when you were younger, or when you were training more consistently. Please start at your current level. Increase the intensity in small, gradual, calculated increments. Many times, injuries occur because someone is doing too much too soon, or they are trying to recover from an injury too quickly. You want to give your body the tools to recover correctly and completely. Anytime there is a nerve entrapment condition, there can be a recurrence of this condition. So you want to make sure that you give yourself time to recover completely. Thanks everyone for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I covered Pronator Syndrome. If you have questions, feedback, or suggestions, please leave them in the comment section. Please feel free to like this video. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can connect with me on other social media platforms. Also, when you go to my website, you will be able to find my blog. My blog contains articles on sports medicine, chiropractic, health, fitness, and exercise. Please, please, please always remember to train hard, but train smart and get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your